Welcome to our Rush Generations lecture on the ABCs and Ds of Medicare. We are very happy that you decided to join us today for our Rush Generations lecture for today. And then for those of you who are joining via YouTube, you can go ahead and add your questions into the chat. And we will address them at the end of the lecture. And for those of you who are calling in via phone, at the end of the lecture, when we open it up for question and answers, we will be able to, you will be able to unmute yourself to ask questions, and you will do that by pressing *6 on your phone. So *6 on your phone, the *6 on your phone will allow you to unmute yourself so that you can ask a question. You'll be unable to do so until the time of the lecture until the time of the question and answers. But until then, we will listen to our wonderful presenters. Before I begin to introduce them, I would like to promote some of our upcoming Rush Generations programs that might be of interest to you. And for all of these programs, you can give us a call at 1-800-757-0202 to be able to access those programs and register for them. Our first workshop, our first offering is Rap for Seniors. This is going to be our Rap for Seniors workshop in Spanish. Tú vienes a tu manera. This is going to be Thursday, September 23rd through October 28th from 3:30 to 5 p.m. on Zoom. Rap for Seniors is specifically for people 60 and up. This will be in Spanish. And it will be around making and setting goals around mental and emotional wellness, but also physical wellness. The next is our Walk with Ease program. This is going to be one of our first back to in-person programs. It's going to be Wednesdays, Thursdays, and Fridays. Sorry, these dates are a little wrong and need updating. It's going to be starting September 22nd from 10 to 11:30 a.m. And it's going to be in person at the Garfield Park Conservatory. So if you are near the Garfield Park Conservatory or want to make the trip, it is free parking. Go ahead and sign up by calling 1-800-757-0202. There's going to be lots of perks from the conservatory for folks who are participating in our Walk with Ease walking group. Also, we have our Rap for Seniors in English that's also starting Wednesdays, October 6th through November 10th from 10:30 a.m. till noon. You can sign up for this as well. Remember, this is a workshop for making and setting goals for mental and emotional wellness, but also physical wellness. We also have our Coping and Connection at the Time of COVID support group. This is a telephonic support group on the third Wednesday of every month from 3 to 4 p.m. If you are just looking to connect with other people, or if you're feeling lonely or isolated during the COVID-19 pandemic, this is the group for you. We also have our Diabetes Education and Support group that meets over the phone on the third Thursday of every month from 2 to 3 p.m. And then if you are feeling lonely or isolated and just want someone to talk to every week, you can receive a friendly call from a trained volunteer every week through our Rush Generations Senior Connections Friendly Caller program. So feel free to give us a call to sign up for that as well if you want to receive a friendly call. And then if you are an adult and are a caregiver for an individual 65 and older, and you need more information or assistance or support in providing that caregiving service, you can reach out to 312-563-0350 to be connected to our Rush Caregiver Initiative to see if that might be a good fit for you. And of course, we always want to hear from you. Through the Shaman Senior Voices program, we want to learn what matters most to older adults as you age. So what matters most to you? You can actually take your camera and look over this QR code here and get a link to Record your story and tell us what matters most to you as you age. Or you could put into your browser bit.ly/record my story. All right. Without further ado, I want to introduce our presenters, Danielle Keel and Stephanie Bailey. So let's see. So Stephanie Bailey is a licensed clinical social worker with over 20 years of experience working with older adults. She has worked for many healthcare organizations and nonprofit agencies, and she has worked at Rush since 2013. She is currently stationed at Rush Oak Park Hospital, where she provides social work support for several outpatient specialty clinics. She is a certified senior health insurance program counselor and hails from several places. And hails from several places, including Washington, D.C. and Fort Worth, Texas. And then Danny Keel is a licensed social worker and a certified senior health insurance program counselor. She has several years of experience working with older adults and individuals with developmental and intellectual disabilities. She started her career journey at Rush in March 2021 as a community social worker for contact tracing and COVID-19 research. She recently has transitioned to working as a social worker with a health promotion and disease prevention team, providing social work services for Rush Generations programs and Stallman Senior Voices. So without further ado, we want to give a warm welcome to Danny Keel and Stephanie Bailey.
Good morning, everyone. I'm hoping you can hear me okay. This is Stephanie, and I will be leading us through the slides. So as Patrick said, thank you so much for that. Danny and I are both SHIP counselors, and that's the Senior Health Insurance Program in the state of Illinois. We're happy to be with you today. And again, we'll take your questions at the end. So today our learning objectives are to give you a broad overview of your options with Medicare, understand the different ways to access those benefits. And because we all know the costs are very high, explore ways to make all of this more affordable. So what is Medicare? We all know it's a federal health insurance program. It's confusing right off the bat. So it's run by CMS, the Centers for Medicare and Medicaid Services. The benefit decisions are controlled by Congress, and Social Security handles enrollment and eligibility. So I always point out when you have concerns about these benefits, how much they cost and the way things work, just note that the benefit decisions are controlled by the United States Congress. So please always keep that in mind, and remember to vote for senators and representatives who have your interests at heart. We'll talk a little about eligibility. We won't spend too long on it because I am guessing that most of you who are on this presentation today are already on Medicare, but it's useful to know. So a U.S. citizen or legal resident is the first qualification. And for most people, they're 65 years of age or older, or under 65, receiving Social Security disability benefits. So that's SSDI, not the same as SSI, for at least 24 months. So basically there's a 2-year waiting period, unfortunately. An exception is made for individuals with ALS or end-stage renal disease. I'll talk a little about that just for a second. For those with ALS, also known as Lou Gehrig's disease, in this case, Medicare automatically begins the first month that your disability benefits start. You don't have that 24-month waiting period. With end-stage renal disease, when your Medicare benefits starts, if again, this is under age 65 only, when your Medicare begins depends on your individual treatment plan. So there's an entire booklet that Medicare puts out that's called Medicare Coverage of Kidney Dialysis and Kidney Transplant Services. And you can get that by calling Medicare. We'll provide you with those numbers. So just know that there are exceptions made for these two health conditions, and frequently other health conditions come up that we and other people try to advocate for people to start receiving benefits sooner. And this is something that the US Congress can help us with. So again, voting is tremendously important with your Medicare rights. So next slide. For people over age 65, sorry about that, I went too fast. Can you go back one, Danny? Thank you. For people over age 65, 65 and older, they are eligible, they have to be eligible for benefits under Social Security, should be a comma there, sorry, railroad retirement, federal, state, or local employee, and they have to have 40 or more credits of Social Security covered employment. So this basically means that you have to have worked for about 10 years full time for a company or agency that was paying in to Medicare benefits. So mostly that falls under FICA, is what it says on your pay stub. Also, that last point there, if you're married, you may receive benefits under a spouse's work record. And if you're no longer married, but you were, typically you have to have been married for at least 10 years to receive benefits under a former spouse. Next, we'll talk just briefly again to remind you about others who are eligible are people with disabilities under 65 who've been getting that SSDI for 24 months or more, and then at any age with those two conditions listed there again at the bottom. So others can purchase Medicare. So for most, the situation that comes up a lot is they're age 65, but they don't have enough work history. So maybe they worked for 8 years full time, or they worked for 10 years, but it was part-time jobs here and there, and they don't have enough sort of credits, enough quarters, work quarters, I'll say. So you're able to purchase Medicare coverage, but it can be expensive. So if you've worked for 29 credits or last 29 quarters, it would be almost $500 per month. If you've worked a little more than that and you have 30 to 39 credits or quarters, you can buy it for $259 per month. So Part A is not really affordable unless you have those work quarters. But there's other ways to make it affordable. We'll get to those, don't worry. These amounts have been updated for 2021. We don't know the 2022 ones yet, but those are the qualifications. So you can still get it if you don't have enough work quarters. So on the next slide, just briefly, this is what we're going to go into in great detail today, but this is just a quick overview. So original Medicare Medicare has parts A and B. That's traditional Medicare. We're going to go into detail with that. And then Part C is just a different way of getting your A and B benefits through private companies that have contracts with Medicare. And then we're going to talk a lot about Part D, prescription drug plans. So we're going to get into the nitty-gritty of A, B, C's, and D's. And for this next portion, I'm going to hand it over to Danny. Thank you.
Thank you, Stephanie. Yeah, exactly what Stephanie was saying. So Medicare does have 4 parts. So let me go ahead and get into that. So yeah, so original Medicare, you're going to have Part A and Part B. So Part A is going to be that hospital insurance. So it's going to be that coverage when you're in the hospital, you have to go to a skilled nursing facility, home health services, and hospice. And then Part B, we like to consider medical insurance. So that's when you go to your doctors for doctor visits, outpatient services, preventative services, lab tests, ambulance services, equipment, supplies. So that's going to be that original Medicare. And then below, you're going to have Part D, so that's the Medicare prescription drug coverage. So that's going to cover your prescriptions and your medication. And then you have the Medicare Supplement. So that's also known as Medigap. So that in addition to Medicare, it's going to be covering costs that maybe Medicare didn't cover all those costs. That supplement plan is going to kick in and cover the additional cost. You must have Part A and Part B to have the supplement plan. And then Medicare Advantage or a Medicare replacement. So it's technically a part of Medicare, but we like to have it on a separate side. So it's considered Part C or that replacement of Medicare. So you still are going to have the same benefits of Medicare, but it's going to be sold by private insurance companies. And it's going to be kind of a combination between all the different parts that Medicare has to offer, including prescription drug plans. We like to do a visual. So this is one representation of how we can divide out all the different parts of Medicare. So on that left side, you take it as puzzle pieces, I'd like to say. So you have a puzzle piece for Part A, a puzzle piece for Part B, puzzle piece for Med Sup or a secondary insurance plan, and then a puzzle piece for Part D or your secondary insurance. So those 4 puzzle pieces create the original Medicare, and that's going to be on that left side. And then on the right side, you're going to have the Medicare Advantage. So you're going to have a couple puzzle pieces there. So one puzzle piece for Part A and B, and then a puzzle piece for some that have Part D, so that prescription drug coverage. This is another representation as well. So if you look at the diagram, on the left side, you're going to have original Medicare. So that's going to be Part A and Part B. Below those boxes, you're going to have Part D prescription drug coverage. And then below that box, you're going to have that Medicare supplement insurance. Then on the right side, you're going to have a box for Part C. So that's a combination of Part A and Part B, usually Part B. And then you're going to have below that Part D. So those are kind of 2 diagrams that kind of have a better visual on either using the puzzle pieces or this diagram to kind of split it up. And when you're first eligible for Medicare, you have to pick which side you want. So you can pick the left side, so that original Medicare with Part D or the Medicare supplement plan, or you can pick the right side, which is going to give you a Medicare Advantage plan and prescription drug plan. So Medicare has enrollment periods. So when you're first eligible, you're going to have we call it the 313 rule. So let's say you turn 65 in July, you're going to have 3 months before that, before your 65th birthday, to enroll. And then you're going to have that month of your birthday to enroll. And then you're going to have 3 months after as well. This also is good for if you have your disability. So on your 25th month of your disability, you'll be eligible 3 months before that 25th month, during that 25th month, and then 3 months after that. And then some beneficiaries are automatically enrolled. So let's say you turn 65, and even though you may be still working and have health insurance coverage elsewhere, you're eligible to get that Medicare Part A. And we'll definitely talk about more on penalties and fees if you don't take it when you're eligible. But just know that you can automatically be enrolled, and Part A is typically free unless, like Stephanie mentioned briefly before, you may have to pay if you didn't work enough quarters for it, and it can be expensive. But for the most part, it is free. However, Part B is when you're going to get that monthly premium of the $148.50 a month. But just know that you're eligible to sign up for free for Part A at any time during or after your initial enrollment period. And then if you have to buy Part A or Part B, you can only sign up during a valid enrollment period. And we'll talk about special enrollments and all of that a little bit later, but just know the initial enrollment, you have about a 7-month window from when you turn 65 or on that 25th month of your disability. And again, like Stephanie said, if you do have that ALS or end-stage renal disease, sometimes the enrollment periods, you don't have that waiting period. So you don't have to wait for the 25th month of disability with ALS. You'll be able, once you get your disability, you'll be able to apply for Medicare.
Okay. Sorry, Danny. So other times you can enroll. We have the special enrollment that can be used to delay enrolling in Part B. So again, most people take Part A when they're first eligible because it's free for most people. And if you delay enrolling in Part B, the reason for most people is that they are still working and covered by an employer group health plan. If that is the case, you need to check with your employer and make sure that you get a letter of creditable coverage. And that letter of creditable coverage is just a letter that says that your employer offers coverage that is at least as good as or better than Medicare. And that will allow you to go ahead and enroll late in Part B without having a late enrollment penalty. If you don't enroll when you're first eligible for Part B, or you miss that special enrollment period after your work coverage first ends, you do get a chance each year to pick up Part B. Right now it's January through March, through the end of March every year. but your coverage would not begin until July 1st. But starting in a couple of years, this is exciting. Starting in 2023, there's not going to have that waiting period until July 1st. It will be when you enroll, or the first of the next month after you enroll in Part B. And unfortunately, there are penalties for enrolling late in Part B, and also in some of the other portions as well that we'll touch on. So you don't want to go past that window of opportunity that you have after your employer coverage ends. And next, we'll touch briefly on who needs to enroll in Medicare and who is automatically enrolled. So you'll need to apply for Medicare if you're not yet taking Social Security, you're not yet eligible, or you decide to delay. You can apply through Social Security by calling that number there. This number will come up several times during the presentation, so don't worry if you miss it, but call Social Security. It's SSA 1213. That's an easy way to remember it, 800 SSA 1213. And calling early in the day is always recommended. And again, you're automatically enrolled if you are already receiving Social Security benefits when you become Medicare eligible. So for most people, when you turn 65. And to remind you, we're going to go back to that puzzle for just a second that Danny was showing us. So we are now going to look at the left side. So this sort of 4-piece puzzle. So we're going to head down that road first and say that you decide to stick with original or traditional Medicare. So we're looking at that left side. So with original Medicare, that's your red, white, and blue card. It's a pay-per-service system. All Medicare beneficiaries receive this Medicare summary notice every 3 months. It will automatically show you supplies and services billed to Medicare. It is not a bill. It's like for private insurance, they'll usually call it an EOB, explanation of benefits. So that's what that is. It's just showing you a summary of the services that you used and that were billed to Medicare. It's not a bill. Original Medicare is accepted by almost all doctors. Haven't seen one yet that does not take it. There are limits on what Medicare pays the doctors and hospitals, and it covers most medical needs. However, there's no maximum out-of-pocket limits, which means that unfortunately, sometimes you do end up with large costs. Here's what your card should look like. Everyone should have this newer card. They used to have the Social Security number. I'm sure a lot of you remember, and they have removed that. You can still, though, when you call Medicare, you can still give your social if you don't have this number handy. Obviously, they're a lot harder to remember, and they did that on purpose. They don't want us giving our socials out to everyone. But that is why they have changed that number to a number that's really hard to remember. Part A coverage. Don't worry, I'm not going to read this whole slide to you. It's way too much. But Part A coverage in general includes hospital care in acute care hospitals. So critical access hospitals, your time in the emergency room when you are admitted to the hospital, skilled nursing facility care. So some people call that a SNF or a nursing home with limits. All of these have limits, but in general, hospital, nursing home, hospice, and home health all fall under Part A. Briefly on this slide, I will touch on what's not covered. So unfortunately, things like private duty nursing, a private room, unless that's all that the hospital has, telephone and television in your hospital room. Some of these things fall outside of Part A. So it's kind of odd things, but most of those services are going to fall under A. And next, we'll talk about your costs. So again, as we've said, most beneficiaries, so most people on Medicare do not pay a monthly premium for Part A. The costs can be quite a lot. The first day in the hospital is $1,484. That's your portion of it. And so for a lot of insurance plans, I'll go into this just a tiny bit. Generally speaking, Medicare operates like an employer insurance with the yearly deductible and co-payments and co-insurance. But Part A is a little different. So it depends on how often the person is admitted to the hospital. Where you probably run into this the most is when you are admitted frequently for a particular illness or complication. So rather than working by a calendar year, it's based on when you're first hospitalized. So unlike an annual deductible, this benefit will reset after you've been out of the hospital for 60 days or more. So for example, if you're hospitalized January 1st for a fall, you have surgery and you're discharged home with home health for continued therapies at home, which the home health would be billed under Part A as well. But then you're readmitted on January 31st from a complication that resulted from the surgery that you had at the beginning of January. This hospitalization remains under the initial benefit period because it's within less than 60 days of January 1st. And so in this case, you've already met the deductible and you don't get socked with a second $1,484. It's a little bit confusing, but it helps us as hospitals, as healthcare providers, to try to correct all of the problems that we see when a person is initially hospitalized. So if the same person was then, they went home for some period of time and was hospitalized again in June, that would initiate a new benefit period, and they would be subjected to a deductible again, the $1,484. One notable thing often that we want to make sure we talk about is observation periods. So this may be up to 72 hours in the hospital if you do spend it in an emergency room, or even if they transfer you over to a regular hospital room. Sometimes you are under observation, and that is treated differently by Medicare. So it's really important to ask, and hospitals are required to let you know whether you're in observation status, because those can cost you significant money given you're having to pay a portion of it. Okay, I'll talk briefly about Part B. So these again cover outpatient services, doctor services, outpatient treatments, labs. When you come somewhere to a hospital or to other healthcare provider for physical or occupational therapy, lab tests, ambulance, durable medical equipment, and we'll talk a little about more of these. For durable medical equipment, this is something like a cane, walker, or wheelchair that you require at home. The doctor has to write a prescription. It has to be medically necessary, of course, and you have to use a supplier that's enrolled in Medicare, so meaning that Medicare can easily pay them. Part B, preventive services. Again, I won't read all of these, but just know that many preventive services are covered under Part B, including these. This isn't even a total list. Several more have been added over the last couple of years, including screenings for HIV, hepatitis B, and cervical cancer. You can call Medicare and they'll send you a booklet called Your Guide to Preventive Medicare Services. And it's really important to know what's offered to you. And these are covered. Your Part B costs. So it's going to cost you, for almost everyone, $148.50 per month for most beneficiaries. People who have an income of more than $88,000 a year for one person, or $176,000 for a couple. For a married couple, will pay a Part B premium of $148.50 plus a little bit more. So not covered by Part A or Part B, unfortunately, are things like long-term care. It's also called custodial, meaning long-term care in a facility for ongoing needs, not something that's related to a recent fall or surgery. Most dental care, most eye exams, dentures, all of these things. So you can see there's a lot of things that unfortunately aren't covered by A or B. And we'll talk about ways to get those. And we'll talk a little about Medicare supplement plans now. So these are also called Medigap or Medicare Supplement or Med Sup. So you might hear it called all of these things. It's health insurance sold by private companies to supplement or meet the gap that Medicare does not cover. So as we've seen on these last few slides, Medicare can get really expensive. And unfortunately, it was never designed to cover all of our medical costs. For most Medicare covered services, not those preventive Part B tests and things that we just talked about, but for most Medicare covered services, Medicare covers 80% and you're left with the 20. And with a group policy, such as your employer, many of them have an out-of-pocket maximum where they cap what you're going to pay at a certain amount. And unfortunately, Medicare doesn't have that cap. This is why having the extra coverage is important. Medicare supplement plans are not the same as Medicare Advantage plans. And in fact, you're not allowed to have both at the same time. So just keep that in mind. Medicare Advantage plans, we're going to talk about a little bit later. Right now, it's Medicare Supplement, designed to pick up the extra 20%. And this is how Medicare supplements work. You pay an additional premium for a Medigap policy in addition to your Part B and any Part D premium that you may have. Again, Medigap or Medicare supplement policies are different than Medicare Advantage plans. There's 10 standardized plans, and just to make it super confusing, they have alphabetical letters as well. Generally, once someone enrolls in one of these plans, that plan is kept long-term, so you don't have to be changing your Medicare supplement plan every year during fall open enrollment. You can enroll anytime. It's a very good idea to enroll when you're first eligible for Medicare, but you don't have to. And you generally just keep that plan once you're in a Medicare supplement. That's what you keep. So we're still talking about Medicare supplements, and these work with original Medicare or traditional Medicare only. So if you have A and B, you have to maintain both A and B. It covers the major gaps in Medicare, and it only covers Medicare approved charges, meaning that they're not going to pay for things that, or maybe certain elective surgeries or things that aren't going to be covered by Medicare. There's no sort of gap to cover because the service isn't covered at all. Again, 10 standardized plans available in most states. And the more a plan offers, of course, that tends to be a little more expensive. Plan benefits are identical from company to company. So a Plan C from Mutual of America is going to be the same as a Plan C from United Healthcare. I'm just tossing out those randomly. Some plans are starting to offer additional benefits like dental, and all of them are covering the Part B coinsurance. I really briefly mentioned Med Select. We don't see this very often, but Med Select is a particular type of Medicare supplement that offers a lower monthly premium because you must use a specific hospital or provider. And you have to use that particular hospital for your inpatient and oftentimes outpatient as well. Again, there's an initial enrollment period, and this is the first, when you're first eligible for Medicare Part B. So for a lot of people, they may not pick up Part B right away, but once they stop working, maybe they're age 68, they decide to go ahead and pick up Part B. It is a good idea to enroll in a supplement when you have the first opportunity. During that first 6 months, when you have Part B, it gives you a guaranteed right to buy any supplement. They can't turn you down based on your health status or based on, whether you were a smoker or different conditions that you may have. Every state has different rules. And I'll talk a little about Plan F and Plan G. They have started to change C and F. So these plans, if you have them, no worries, you can keep them. Plan C and Plan F are no longer offered to new enrollees. If you have them, you can keep them. And if you already had Medicare before January 1st of 2020, you may still be able to choose one of these plans. But again, most people go ahead and stick with the Medicare supplement that they first enrolled in if they're happy with it. There's no need to go changing those every year. Medicare supplement plans, so that last piece, don't have a network. So you don't have to worry about, if you're in traditional A and B and you have a supplement, you do not have to worry about, does my doctor accept this supplement or that supplement? As long as your doctor takes Medicare, the supplement is going to pick up the difference for the approved amounts. Thank you. They all are going to cover the same core benefits, and I won't go into these in great detail as I don't want to take up too much more of our time on the Medicare supplement plans, but just know that they have a standard sort of core set of benefits that they cover. And again, for the next slide, the best time to enroll is within your first 6 months of enrolling in Part B. This allows you to have guaranteed issue. There may be some other situations where you can have guaranteed issue right. And once a plan is selected, the plan is held long-term. The annual open enrollment that's coming up does not apply to Medicare supplements. You just stick with that plan. And enrollment in these plans is completed through the individual companies, not through Medicare. A couple of other forms of supplemental coverage are retiree benefits and employer or union benefits. And just know that there are very specific rules about when one covers versus another. And again, we'll remind you of this, but it's always a good idea to talk to a SHIP counselor, which is free Medicare related options. We provide options to you. And we're going to give you that information during this presentation. Every state has a SHIP. I'll repeat that at the end. And it's always a good idea to talk to a SHIP counselor because we are not selling anything. We don't have an interest in getting you to enroll in a particular plan or particular this or that. We're not selling anything. And now we're going to turn it over to Danny for Medicare Advantage.
All right, so Medicare Advantage. So if you think back to that puzzle, we're going to be talking about the right side of that puzzle. So Medicare Advantage plan, those are going to be alternative plans to the original Medicare. So they do have Part A and Part B. It's still within the Medicare program with all the Medicare rights and protections, but these plans are sold by private insurance companies. They have different type of plans. So that's going to be either an HMO, a PPO, or a PPF, and those are PFFs. So those are going to be the private fee-for-service plans. It is good to note that the private fee-for-service plans can be pretty expensive, and you're going to be paying out of pocket for most of your services. And how they work. So Medicare Advantage plans. So let's say that you have a doctor and a hospital that you prefer. If you select a Medicare Advantage plan, you have to select something that's in network. It's called a network because those providers or those hospitals are within that network setting. So you want to make sure that if you're selecting a plan, you want to make sure that your doctor is in network or your hospitals are in network. Otherwise, you'll get, extensive bills and all of that. But with these plans, you're also eligible to get extra benefits. So like vision, hearing, or dental services. And then with these plans, you can select to enroll in the plan for the calendar year and reevaluate the plan during the annual open enrollment. I'll talk a little bit about kind of like that second chance program with the Medicare Advantage plans. So with Medicare Advantage plans, it can have premiums, and those monthly premiums may be lower than the Medigap plans. So like Stephanie said earlier, you cannot have a Medicare Advantage plan and a Medigap plan at the same time. So it's kind of, you have to choose one or the other. But in this case, Medicare Advantage plans, those premiums might be a little bit lower, but you're still going to have that copay insurance for each service. And then your premium is going to be paid in addition to the monthly premium of Part B. So you're still going to be paying that $148.50 for that Part B Medicare. And this Medicare Advantage plan will have additional cost anywhere from roughly $0 to $100 is what we see on average. So that would be in addition to the $148.50 monthly. So Medicare Advantage plans are now required to have a maximum out-of-pocket limit cost. So for Medicare Part A and Part B. So that cost right now in 2021 is $7,550 or less. So let's say that you reach that and you reach that maximum out of pocket. That means that you will no longer have to pay for the Part A or Part B coverage services for the remainder of the year. Your plan will pick up those additional costs. And then what you can consider before choosing a Medicare Advantage plan, I really want to stress the first bullet point. So you want to make sure that the plan that you select, you're able to see your current doctor and use the hospital of choice and get your full benefits. A lot of the times you can shop for a plan, and let's say you call a sales representative and you're like, oh, is my doctor included? Here's my doctor's name. Here's what clinic he's at. And maybe the sales rep is like, yeah, he takes that plan and all of that. And then all of a sudden your plan starts and your doctor's like, oh, we're out of network, we can't take you. You definitely want to call your doctor or the hospital directly and ask them, like, I'm thinking about doing this Medicare Advantage plan. This plan is so-and-so, Blue Cross Blue Shield or Humana, for example. Does my doctor take this plan? Sometimes doctors' offices, each year they might pick and choose what plan they're going to be accepting. So it's really, really stressing to make sure that your current doctor and hospital of choice are accepting that plan. And then you want to know if the plan covers your prescription drugs. Prescription drugs can be extremely expensive, and we'll talk later about how you can save on all of that with extra help and all of that, but just be mindful that you want to make sure that your plan is going to cover that, because you want to pay as less as possible. You want to know the monthly costs, such as premiums and copays for the various services you may need. And then you want to know when and how you can get out of it. If you don't like it, you don't want to be stuck in a plan for an entire year where you weren't able to see your doctor or had to pay, an extensive amount for your prescription drugs. So you just want to consider all of that before selecting a plan. So the enrollment periods for the Medicare Advantage plans, those are going to be every year from January 1st to March 31st. And that gives you the option to enroll or disenroll during that time frame. A beneficiary enrolled in a medical advantage plan will also be able to make a one-time change to another Medicare Advantage plan or return to original Medicare and enroll in a standalone prescription drug plan. Beneficiaries can also continue to use Medicare annual enrollment period. So that's October 15th to December 7th to enroll or switch or disenroll in a Medicare Advantage plan. So you do have options, because we do see frequently that someone will choose a plan and then all of a sudden they don't like that plan or something happens. It is that second chance where you're able to go into a next plan or choose another one. And now a little bit about that right side. So that's the right side of those puzzle pieces. And now we're gonna kind of switch it and talk about Medicare Part D. So what Medicare Part D is, that's our prescription drug coverage. So it's offered by private drug companies for people with Medicare. So there's two different parts. So you can have that part where if you're enrolled in original Medicare, you can enroll in an insurance plan that covers drugs only, and that's going to be called a prescription drug plan or a PDP. But then also if you're enrolled in a Medicare Advantage plan that includes prescription drug coverage, it's going to be called the MAPD. So that plan will cover the drugs and your other health benefits. It's important to note too, so let's say you're enrolling in Medicare, you're going to be eligible for Part D, but let's say maybe you're not on any medications. It's important to know that even down the line, let's say now you have one or two medications that are going to be costly, you want to enroll in Part D when you're first eligible. Otherwise, you can get charged a penalty fee. So it's important that, again, if you may not take medications now, you're going to get those late fees or penalty fees if you don't enroll when you're first eligible. And it can be really affordable. I know most prescription Part D plans are roughly around $35 to $50 a month. So that's just good to kind of take in mind that, maybe I don't need these medications now, but I'll need them down the line. So you can basically save some costs down the line. And then what's covered in or under Part D? So each plan has a list of covered drugs. So you can actually use the Medicare website too to plot in all of your prescription drugs, and it could kind of navigate which drugs will be covered in that plan, which drugs would not. And most of the times we get everybody, and then there's just like one drug or two drugs that aren't covered, and we're calling doctors' offices and we're trying to get, maybe a generic drug or something like that. But the website really helps navigate what plans would be most cost efficient. And then it is required every year to, or it is required to give a 60-day notice for any changes as well. So then Medicare Part D plan costs. So again, it varies by plan, but monthly premiums will be higher if your annual income is more than 87,000 if you're single, or 174,000 if you're male and are married. And that's the 2021 rates. It may change in 2022, but again, those are the 2021 rates. Typically, a deductible is anywhere from $0 to $445. Again, that's in 2021, and it's going to depend on the plan. You have co-payments or co-insurance for each drug filled. That may fluctuate during the year because Part D, it's kind of like a donut hole. We'll provide more information and more details on that. But again, when I talked about the late enrollment, so let's say you're eligible, you didn't do it, you'll get charged 1% extra Part D premium fee if you didn't enroll when you were eligible. So let's say you enrolled this year, and let's say maybe 2 years from the line, you all of a sudden got all of these medications and drugs that you want covered, and you want to enroll in a Part D plan, you'll get charged that 24%. So that's been 24 months, you'll get charged 24% for that Part D premium. So that would be the penalty fee. So it is good to enroll when you are eligible. We always advise that. And then this is just kind of a breakdown of the costs. So original Medicare with Part D and supplement. Again, for Part A, for the most or majority of individuals, you're going to be paying $0. For Part B, you're going to be paying that $148.50 a month. Again, that's for most individuals. And then Part D, for the prescription drug, you're going to be paying around $35 a month, and that's like the average premium. But you'll also be paying some copays for that. And then the supplement plans, those are going to vary plan by plan. And then a little bit of cost of Medicare Advantage with drug coverage. So it's similar. So Part A, you're going to be paying $0 for most. Part B, you're going to be paying $148.50 for most. Part C, so that's that around $0 to $200 on top of the $148.50. So the Part B premiums. So that'll probably around $350 as an average. You also would have to pay copays for medical care and drug costs. And now I'm going to take it back over to Steph, and she's going to talk a little bit about checking your coverage and some benefits on how you can get lower costs.
Thank you. Yes. So if you're confused about what you have, a lot of times people aren't sure exactly what they have, whether they have a Medicare Advantage plan or Medicare Supplement, for example, or when their benefits are going to start, things like that. So if it's questions about your current coverage, Medicare is your best bet. That's that top number. And if it's questions about eligibility, that would be the second number, SSA. Medicare.gov has a great plan finder tool. You can search for health and drug plans. So you can compare Medicare Advantage plans. You can compare Part D plans. Of course, Medicare Advantage plans with Part D, that's included. You can also search for Medicare supplements on there now. So it's really good. There's a lot of personalized searches you can do on Medicare.gov. And if that's overwhelming and confusing, that's exactly what SHIP counselors are here for. So we'll get to that a little later. Again, just an enrollment summary. Our annual open enrollment is coming up. It's October 15th through December 7th. I always ask if it's a group of younger participants, why they chose December 7th. I am guessing that most of you know, if you're already on Medicare, why they chose December 7th. That's a very easy date for many older adults to remember because of it being Pearl Harbor Day. So we always know that it ends on December 7th. But it starts on October 15th. And that is why they chose December 7th as the ending date. So be sure to contact Medicare or SHIP counselor when you're first eligible for Medicare. We can help you figure out those initial enrollment periods, which are very confusing. And then you kind of can make a plan for enrollment based on your specific situation, whether you're still working, what kind of coverage you need, what kind of specific health conditions you have, and you can choose which direction you want to go, whether you want to choose that kind of left path or the right path. And always, that last point is very important. Keep documentation of what you decide to do and why, and who you talk to. This is especially important if you delay enrolling in Parts B and Part D so that you don't get hit with late enrollment penalties. There are a lot of benefits for low income beneficiaries. So these are ways to save you money. Basically, if any of these amounts that we've been talking about, if a lot of you I know are already paying these amounts, and if you are finding these things prohibitive, if these are hard to afford, there are programs specifically designed to help you with them. So first, briefly, Medicare savings programs, a lot of people call them QMB. QMB is one of 3 different Medicare savings programs. And the main thing that they do is they pick up the $148.50 monthly Part B premium. So that is the main thing that they do. If you are low income, if for any reason you're having a hard time affording that $148.50 a month, is worth applying for these programs. They are underutilized. They're fantastic programs. You can call your state SHIP. Again, we're going to give those numbers. Or you can apply directly if you're in Illinois at abe.illinois.gov. Again, I thought that was a cute little thing they came up with. It's ABE for Abe Lincoln, but it's also the application for benefits eligibility. So abe.illinois.gov is a little easy thing you can remember. Just go to ABE and see if you can qualify for a Medicare savings program. Extra Help is another great program. You can have a little bit higher income and still get extra help. What Extra Help is a program that helps with your Medicare Part D costs, so prescription drugs. And you can apply online. It's very easy. It's national. Anyone can do it. You can just even search Social Security Extra Help application. Social Security is the agency that manages eligibility for this program. You can currently best to call, of course, not in person, but by calling 800-772-1213. They can help you do it over the phone. SHIP counselors can help you do it over the phone. It's quick and easy. It's a lot quicker than a lot of other applications that we see. So please remember Extra Help with Part D costs if you're having a hard time affording your Medicare Part D costs. And now we'll talk a little about Medicaid. So this is managed differently in different states. So for the purposes of this next few slides, it's going to be specific to Illinois. Medicaid covers medical expenses and prescription drugs. It helps pick up the gaps that Medicare doesn't cover, and it kind of acts like a supplement for those who are low income. It is income-based and it's pretty low. So currently it's around $1,100 a month for one person. So if you earn less than $1,100 a month, it is worth applying for this program. And I can't see my slides. I hope you guys can still see me and hear me okay. I had a brief interruption, so let me know if you cannot. But Medicaid helps with a lot of things, and you can apply online. Again, here in Illinois, it's abe.illinois.gov, and it will fill in the gaps that Medicare does not cover. Here in Illinois, it's administered by the Department of Healthcare and Family Services, or HFS, there are many different categories. The short version is there are many programs available to help if you're lower income. If you're over $1,100 a month and you're still having a hard time affording all of these things, please know that you can apply for Medicaid under what's called spend down, and we can help you figure that out. There's a lot of really specific rules about spend down, what can be used, how to apply, but just know again that SHIP counselors can help you with that. Okay, good. Thank you for advancing the slide. So I'm hoping this means you guys can still hear me. I think that does. So I will continue. These are some of the various parts of financial screening, pieces of financial information that are needed when you apply online for Medicaid. Also, many of these things are needed for the Medicare Savings Program and also for Extra Help. So these are kind of things that you want to have on hand. It's just a really quick overview of what you might need to apply online for these programs. So you want to have these things handy. A lot of times it takes a little bit of time to find these things, especially bank accounts. They ask a lot of really specific questions about burial accounts, whether you have a burial plot. They ask just a lot of very specific things. So it's good to start gathering these things if you're thinking you want to apply for some of these programs. One of the things that they ask that's always strange is the make and model of your car. Even though that does not count against you, they're not going to say, oh, you have, some fancy expensive vehicle. Most of us don't have, but that's not going to count against you. But it is something they ask on the Medicaid application. So you want to have that handy.
Hey, Stephanie,
Yes,
for folks who are audio only, could you list those out?
definitely. Thank you. I picked up my phone. Okay, marital status, household size, and dependence. So you're going to need to have that handy. You need people's social security numbers for all household members. If you do not have them, you can still fill out the application. That is okay. Housing type, so rental versus your own home, that type of thing. Veteran status, medical conditions, monthly medical expenses. So these are things that you'd want to list what you are paying for things, all of those things that aren't covered by insurance, all of the copays, all of the trips back and forth to the doctor. All of these things can help you when you're applying for Medicaid. If you're over the income limit, they can help you get the benefit basically by showing you have a lot of monthly medical expenses that are not covered by insurance. It's going to ask for your monthly gross income and where that money comes from. It's going to ask for assets, and this would include cash on hand, bank accounts, stocks, life insurance. And this is where it will ask that odd question about burial plots, any burial plans that you may have in advance, and benefits currently received. So we'll ask you exactly how much you receive every month and whether you already receive SNAP, which some people call food stamps, and all of those things. So all of those things you want to have handy if you're applying online for Medicaid. Again, the website is abe.illinois.gov. And this next screen lists two sites, and thank you for that reminder. I will read these to you. Benefitscheckup.com is a free online tool that connects, it says older adults, and actually we use it for all ages. It's great. Anyone of all ages can do a benefits checkup to see any programs that they may qualify for. Benefits.gov is a government website that includes federal and state benefit programs for which US citizens may be eligible. And you can search by state, by category, or by federal agency, and you can navigate to other resources and learn about a lot of programs. So these are just additional options to find ways to help you save money, because we know it can get very difficult. So next, I'll just read the titles of these. For prescription assistance, there are a lot of ways that you can save money. Discount drug cards. These reduce the cost of prescription medications at the pharmacy. So it helps with over the counter. It just kind of depends. Each pharmacy, a lot of times they have these, and it's definitely worth asking at your local pharmacy. Coupons, discounts, and rebates. A lot of times drug companies offer these, sometimes even free trial sizes of prescription or over-the-counter medications. Patient assistance programs, I think, are underutilized. These are the pharmaceutical companies, so drug companies have patient assistance programs that vary in their requirements. So sometimes you have to be low income, sometimes you don't. Sometimes you have to show that you do not have Medicare, and sometimes you can definitely have Medicare. It's worth looking into patient assistance programs. And I will, on the next slide, we'll talk about how to find them, a couple of really easy ways to find them. And finally, diagnosis-based assistance programs. So these help patients who have a specific illness to pay for medications. A lot of times they help pay for many other things too, for any medical expenses associated with their illness. And we can help you find these again. So prescription assistance, these are a few of the websites that I like that have been really helpful for patients in finding these prescription assistance programs offered by pharmaceutical companies. GoodRx.com is the first one. The second one is rxassist.org. rxassist.org is my personal favorite. It makes it very easy to search for your medication. When you first go to rxassist.org, you select for patients. There's one side, I think it's for providers. We just select for patients. And then you just type in the name of your medication. You can use the brand name or you can use the generic name. And it will bring you a lot of information. It will take you straight to the application forms. It will tell you what the eligibility requirements are. If it says you have to be under 200% of the federal poverty level, a lot of us don't know that off the top of our heads, and it will have a link to what 200% of the federal poverty level is. So I just like rxassist.org for ease of using it. And Needy Meds is also fantastic. That's needymeds.com. It's an informational clearinghouse, also has a fantastic list of programs available. And they also have a great helpline, which is 800-503-6879. And so again, Needy Meds is like Rx Assist. It's not a patient assistance program itself, but it's rather a source of information on hundreds and thousands of programs that may be able to offer assistance to people in need. So all of these are helpful. Blink Health is the last one. I'm not as familiar with that one. And I don't know if any of you all are, but they offer very low prices on a lot of medications. I also want to mention many people also like capsule pharmacy. That's kind of a newer one that I hear a lot of patients talk about. And also Walmart, Walgreens, CVS, Target, and I think Kmart also have a certain number of prescription medications that they make affordable at around $4. And so please make sure and ask at your pharmacy if you're having any trouble affording your prescription medications. I know we're almost at time. I want to make sure we have time for questions, but I want to talk briefly on reputable sources of information. When you do a search, if most of you are using Google, I imagine, and when you're doing a search, always be aware that those first few results that come up for you are going to be ads. Of course, you probably know this, but just be aware that those first 3 or 4 things, when it says ad, please know that's an ad. Be aware of ruthless advertising efforts made by companies to get you to enroll in their plan, mail, online, and phone. And I didn't even put TV on here. I know that you all have seen, I'm thinking of his name, Montana, the football guy that has many, many, many ads. You will just see so many of these things. And I know you all are aware, but it bears repeating. Please be aware that this is advertising and that you should never give out your social security number, Medicare number, or any personal information to salespeople. Reputable sources, so good places to search for this information include medicare.gov, medicareinteractive.org, and KFF. So that's the Kaiser Family Foundation, I believe. They have a lot of wonderful Medicare fact sheets, and that is kff.org. And if you just search KFF Medicare fact sheet on the donut hole, for example, they have a wonderful Medicare fact sheet on that. And I definitely recommend going to these sites. So when you're searching, just be aware that the first few that come up are going to be efforts to get you to enroll in a particular plan that may or may not save you money. So just be extra careful about it. So the senior health insurance program, our whole goal is to save you money. So again, Danny and I are both certified SHIP counselors. Even though the name is Senior Health Insurance Program, it's not only for seniors, it's for any age. It just has to do with Medicare. Anyone who has questions about Medicare or is ready to enroll in Medicare or thinks they might be ready to enroll in Medicare or has had Medicare for 20 years and needs help saving money, that is exactly what SHIP is here for. Again, we're not selling anything. We work with consumers to help them achieve what is most important to them. We'll not tell you which plan to enroll in, unfortunately. I've had a lot of people ask me over the years which plan I think they should enroll in. Unfortunately, SHIP counselors cannot do that, but we can provide you with all of your options and show you what is the most affordable plan in most cases. So in Illinois, this is a free Medicare counseling program. Again, not selling or soliciting anything. We're dedicated to educating people with Medicare or who have questions about Medicare. And SHIP trains people throughout Illinois. So Danny and I have both done a 4-day full training, and we both have to do a certain number of SHIP counseling retraining sessions every year. And we also have to do a certain number of SHIP counseling sessions with Medicare patients every year. So we do a lot of work out in the community. And our most important goal is to help you all save money. I want to touch briefly on for open enrollment. It's important to call early and open enrollment. In terms of this year, we are doing everything. Most appointments, I should say, are going to be offered over the phone. It's very important to call us early. You can start calling for rush SHIP counseling October 1st. And again, I want to remind everyone that SHIP is not only for seniors, it's for anyone with Medicare or anyone who has questions about joining Medicare. Every state has a SHIP, and it's sometimes called different things. So I enjoy these names. In Ohio, it's called OSHIP. In Florida, it's called SHINE. In Texas, it's called HICAP. And so it has different names, but I just want you all to know that every state has a SHIP. And I've recently found the website shiphelp.org. So it's ship, like a ship out on the sea, and then HELP.org, shiphelp.org. And right in the center of that page, it says, find your local SHIP. And it has an orange box that says SHIP locator. And that's the easiest way to find a SHIP counselor near you. So again, if you already know that you want a SHIP appointment with one of our counselors at Rush, you can make an appointment by calling the 800 number. It's the same number that Patrick gave out at the beginning. That number is 800-757-0202. Starting October 1st. Please don't call before then. That will confuse us, and we won't be ready yet. Starting October 1st, we can schedule you for an appointment during open enrollment. If we're full, or if for whatever reason it's not convenient for you, this is the number for all of Illinois, the one that's on your screen, 800-252-8966. And that number can be used to connect with a SHIP counselor near you. And again, SHIP counselors throughout the state are working really hard to accommodate people in their comfort levels, whether that can be in person. Some places it can be, some have vaccination requirements. Most of us are doing it over the phone. And for a lot of people that seems to work just fine, but we'll make an effort to make it work for you and your individual situation. And I will turn it back over to you guys. See if we can take a couple questions.
All right, great. Thanks so much, Steph and Danny. So a question, how safe is it to put out your personal information into reputable websites such as ABE or the DFS or HFS website? And then how do you know that that website is reputable?
That's a good question. I can jump in. Danny, feel free to jump in as well. They have really made some efforts in the last few years. First of all, they're all secured websites. So when you see that little S at the end of HTTP with an S at the end, it's a secured website and is encrypted. I know abe.illinois.gov has really made a lot of effort to prove people's identity. They have added some interesting questions that prove people's identity. Sometimes they'll have a list of towns. It'll say, which of the following towns did you live in? I know it makes these applications take a little bit longer, but they are really trying to confirm people's identity. You have to create a login and a password when you first go on there. I feel very secure using them. I think it's like anything else, that we put out there. I feel like they've really put a lot of effort into making it secure. What do you think, Danny? I'm not sure.
Yeah, and I definitely agree as well. And then even if you're, using SHIP counseling, sometimes we may log in for you. And I can tell you that information. It's not like we're keeping it. We just need it for that time purpose. We just need it to log you into the ABE website and Medicare.gov website. And then sometimes if you already created an account and let's say that you forgot your password and you need to reset it, sometimes they'll even lock you out and you actually have to call Medicare or Social Security to get back in. So they try all that they can to make it as protected as possible. So I definitely think they're secure. But again, with any risk with personal information, there can be slight chances of risk. But for the most part, it is safe. And I wouldn't recommend anybody else to use the websites if I didn't think they were safe.
All right, great. Thank you. And then also, just as I mentioned, if anyone's worried about scams, we have a recorded Rush Generations lecture on our YouTube about safety and scams. So you can visit our YouTube page to see that as well. And then also one question we got was, you had mentioned a donut hole earlier. Could you kind of explain why is it called a donut hole and what is that?
Yeah, and I know I briefly mentioned that, but I'm actually going to let Stephanie take that away to explain a little bit more.
Sounds good. I'm bringing up my information on it because I always get confused as well. So when you are in a Part D plan and you are paying towards your costs, your co-payments, when you get to a certain amount, so you and the drug company are kind of sharing those costs up to a certain amount. And unfortunately, when you hit an amount that they've determined, they have changed this amount a few times and they are letting it go higher. And I'll talk more about that in just a second. But when you get to a certain amount, it's also called the coverage gap or donut hole. I personally call it coverage gap because donut hole is something that we all like, that I think of as food, and coverage gap is not such a nice term, and it's much more unfriendly, more like of a coverage gap. But when you get to the coverage gap, you're responsible for 100% of the costs. For many people, you never reach that coverage gap. And for a brief period of time, for some people, if you have very high drug costs, for a brief period of time, you are paying all of those costs. And then after that, you reach what's called catastrophic coverage. And at that point, the drug plan does kick back in. It was a very confusing thing that never should have existed. It is being phased out. So what I want to bring up, I brought up some information because they do change it, and it's been changing over the last few years. So in 2022, the initial coverage limit, so that period of time during which you're sharing costs with your drug company, has increased. So that means that you'll be able to buy slightly more medications before reaching the 2022 donut hole. So if your monthly medications altogether have an average retail of less than around $350 a month, you won't even enter the donut hole. So for a lot of our patients, it's something that they never even hit. If you do have a lot of very expensive medications and a lot of brand name medications, you may hit it. And this is when SHIP can really come into play and can really help you with saving money and finding ways to make, what's the most important medication that you take? What is, the one that your doctors say, if nothing else, you have to take this one, and we will help you find a way to get that. Obviously, knowing that it's important to take all of them, but we can help you find a way to make them more affordable.
All right, wonderful. Thanks so much, Stephanie. Thanks so much, Danny. So we don't have any other questions in the chat or folks who have called in, so we can probably wrap up early. I'll let Grizel take it away with some final announcements.
I will encourage people, if they have questions or about CHIP counseling or anything that came up during the presentation, to give us a call. Our 1-800 number or toll-free number is 1-800-757-0202. Feel free to give us a call. The announcements were at the beginning of the recording. If you would like to know more about what upcoming programs we have, feel free to refer back to that section. But again, thank you so much, Stephanie, Danny, Patrick, for working on one of the most interesting or sought after lectures of the year. Considering that the Medicare open enrollment period will soon start. Do we have those dates as well? Can you repeat those?
Absolutely. October 15th through December 7th. So during that time, you can change your Part D plan or your Medicare Advantage plan.
Yep, and then if you needed rush assistance for SHIP counseling on that, you can give us a call October 1st or later for open enrollment appointments, and we would gladly be able to assign you to a SHIP counselor. And again, that's our intake line, so you could call 800-757-0202.
That's it. Thank you so much.
Thanks so much, everyone.
Thank
Take
you.
care.
Thank you.
Thank you so much, Stephanie and Danny.
Thank you.
Thank you so much.